What else can you tell us? What else are you working on as part of the fellowship program?
So one of the other things that I've been working on during the fellowship is the recently announced Center for Health Innovation. And it's a relatively new center here at UCSD where we are looking at how AI models and different types of machine learning algorithms can be operationalized and observed in the prospective sense. And so the center is really looking for how we can make more of the larger UCSD population available for these models to learn and to predict, and how the performance of these models can be studied for future use.
So are y'all looking to do this for, I guess, external vendor models that you bring into the system, or these internally developed models, or are you looking to do it for both?
Ideally, we'd like to be able to do it for both. Right now, we're focused on internal models, and there are some vendor developed models that are in flight, and that's a little bit separate from our platform. Our platform really wants to look at some of the really interesting research that's going on our campus and how we can get larger populations involved in that, and work through the data pipelines that need to exist in order for these models to have a good prospective use.
No, that makes sense. I mean, there's always a lot of challenges with bringing in an external artificial intelligence program into any system. There's challenges with integration. There's also challenges in that the data that the model was trained on might not be the same as what you have within your walls. So it looks like you're hoping to address kind of making it easy to onboard new algorithms, as well as to make sure that you can fine tune it with your own data prior to implementation.
Yeah, it's really trying to do things thoughtfully and carefully, but apply these models at a larger scale and get them potentially up and running for study. And so that's the ultimate goal, is that we want to develop these pipelines for models to be studied pretty much at scale and see how they perform, to really grow and learn as model developers, but also as clinical informaticists, deciding on what workflows are working, what workflows aren't working, when do we want or need some sort of AI model. Because it's easy, I guess it's relatively easy to say that you can develop a model that will look at an image, but we have to know what to do with it after and how it's going to change things after. I kind of play in the implementation of these models.